Welcome back to Studious students. In this video, we'll learn thyroid carcinoma in the simplest way possible. We'll cover the gross appearance, histology, important genetic mutations, and the high-yield points that are frequently asked in MBBS exams. Let's begin. Let's start with papillary thyroid carcinoma. This is the gross specimen of papillary thyroid carcinoma. Notice that the tumor is multifocal and relatively well defined. A cystic area can also be seen within the tumor. Now let's look at its microscopic features. On histology, the first thing to notice is the papillary pattern. These finger-like projections are the characteristic microscopic feature of papillary thyroid carcinoma. Another important microscopic feature is the presence of psammoma bodies. These are round, concentrically laminated calcified structures and are one of the classic findings in papillary thyroid carcinoma. Here's a high power view of the psammoma body. At higher magnification, the concentric calcified layers become much more obvious. Another characteristic feature is the clear cell change. The nuclei appear optically clear, giving rise to the well-known orphan Annie I nuclei. Now let's move on to follicular thyroid carcinoma. This is the gross specimen of follicular thyroid carcinoma. Notice the obvious cancerous irregular enlargement of the thyroid gland. Unlike normal thyroid tissue, the tumor appears enlarged and irregular. Now let's look at its histological appearance. On histology, follicles composed of various sizes are seen. These follicles are lined by tumor cells and are one of the characteristic microscopic findings of follicular thyroid carcinoma. Now let's discuss Hürthle cell carcinoma. This is the gross appearance of Hürthle cell carcinoma. Notice that the tumor is encapsulated. Let's see its microscopic features. On histology, identify the normal thyroid tissue surrounding the tumor. Next, notice the capsule surrounding the lesion. An important feature is capsular invasion by the tumor cell, indicating malignant behavior. Within the capsule lies the Hürthle cell carcinoma. Now let's move on to medullary thyroid carcinoma. Grossly, the tumor appears firm and gray-white. Areas of hemorrhage and necrosis are also present. Now let's examine the microscopic features. On microscopy, tumor cells are arranged in nest, as you can see in this image. Another characteristic finding is amyloid depositions between this nest of tumor cells. These two features are commonly seen in medullary thyroid carcinoma. Finally, let's discuss anaplastic thyroid carcinoma. Grossly, the tumor appears white and firm. Areas of hemorrhage and necrosis are also present. Now let's look at the different microscopic variants. The first microscopic variant is the small cell variant. Here the tumor is composed of closely packed cells. The nuclei are hyperchromatic and numerous mitotic figures are present, indicating rapid cell division. The second microscopic variant is the giant cell variant. Here, large pleomorphic giant tumor cells are seen. The third microscopic variant is the spindle cell variant. The tumor cells appear elongated or spindle-shaped and are arranged in fascicles. Now let's look at the etiology of thyroid carcinoma. Two important risk factors shown here are external radiation exposure and excess iodine intake. Both are associated with the development of thyroid carcinoma. Let's now discuss the important genetic factors seen in papillary thyroid carcinoma. This includes RET gene rearrangement, TRK1 gene rearrangement, BRAF point mutation, PTEN mutation, and TERT promoter mutation. Let's understand why these mutations are important. Normally, the RET gene helps cells receive growth signals. When RET undergoes rearrangement, the RET switch remains permanently turned on. As a result, the cell continuously receives growth signals and keeps dividing. Similarly, TRK1 is also a receptor tyrosine kinase involved in growth signaling. TRK1 gene rearrangement permanently activates the receptor, leading to continuous cell proliferation. BRAF mutation permanently activates the BRAF protein. This continuously stimulates the signaling pathway responsible for cell division. PTEN is tumor suppressor gene. When PTEN is mutated, its tumor suppressing function is lost, allowing cells to grow more easily. Finally, TERT promoter mutation increases telomerase production. As a result, Telomeres do not shorten, cells avoid aging, and cancer cells continue proliferating. The important genetic mutations associated with follicular thyroid carcinoma include RAS point mutation, fusion translocation between PAX8 and PPAR gamma 1, and TERT promoter mutations. For medullary thyroid carcinoma, the important mutation is RET proto-oncogene point mutation. For anaplastic thyroid carcinoma, the important genetic abnormalities include p53 tumor mutation, p21 overexpression, CTNNB1 mutation, and loss of heterozygosity. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Studio Students. See you in the next video.